is a heart murmur? A murmur is just a sound that blood makes when moving through the heart. It can be normal, but it can be due to a defect like a hole or a leaky valve. It's an additional sound to the normal lub-dub of a typical beat. We're able to hear it by using our stethoscope, which helps amplify the sounds. A murmur is best investigated with an ultrasound of the heart, which we call an echocardiogram, or an echo for short. This is a test that uses sound waves to create an image of your heart in real time. It does not hurt, and there's no radiation. It typically takes around 45 to 60 minutes to complete the study. All you have to do is lay down. Your cardiologist will be able to interpret the images and help care for you. The most common cause of a murmur in pediatrics is an innocent murmur. Innocent murmurs are also called physiologic, benign murmurs, or flow murmurs. All of those words are interchangeable, meaning that the murmur is innocent and will cause no harm. An innocent murmur is a common physical exam finding and heard in about half of children and adolescents at some point in their childhood. These murmurs are considered a normal variant and with no future health implications whatsoever. It's frequently heard for the first time between the ages of 2 and 8, but can be heard in infancy in some cases. The murmur arises from normal aortic valve vibration produced from the rapid movement of blood as it leaves the heart. I often use the analogy of hearing water flow through the pipes in a house. Hearing the water doesn't mean the pipes are broken or misconnected. It's simply the flow of the water creating the sound. And the idea is same with innocent murmurs in your child's heart. It doesn't mean that the heart has a hole in it or is broken. It's just the flow of the blood creating the murmur sound. Innocent murmurs have a benign natural history and may be louder in times when the flow is changing, such as growth spurts, dehydration, fever, illness, fear, and excitement. If your murmur is due to a structural defect in the heart, your cardiologist will explain the details and create a care plan with you.